I'm Dr. Bianka Soria-Olmos, and I'm a general pediatrician at Cook Children's in Hazlitt. And I'm also the medical advisor of digital health and work closely with Winnie and her team to do parent and family education about general pediatric topics. And I've been with Cook Children's since 2014. I graduated residency and started what I call my dream job at the hospital, which I grew up looking forward to work at. So it's been a full circle from regards to being a pediatrician of where I always wanted to work. I enjoy teaching families about general pediatric topics, helping them through the difficulties of parenting. I am a mom of two boys, a 9-year-old and a 6-year-old boy, and so I'm always happy to share with families my own journey of being a mom. So the relationship between autism and mental health is well known. As we've been studying autism more and more. There's plenty to learn, but it is well known that children and adults that have autism can have a higher risk of having mental health illness or different conditions. And so that is, again, something we're learning a little bit more about. I think something we don't know too much about and maybe is under discussed, or maybe not, we're not as aware of it, is that families that are raising a child with autism or have a family member with autism, can they themselves deal with issues with mental health? And it may be underdiagnosed, it may be under-recognized, and we think it's important to bring awareness to this as well. So it's really important for all parents of children to take care of themselves. It's always something that I talk to all families about, whether it's a family that has a child with a chronic illness, with autism or anything else, or if they have a healthy child, that it's important to take care of themselves, because if they themselves are not 100%, it's going to be a little bit more difficult to deal with the challenges of parenting. So just some main takeaways is take time to yourself. We know that it can be hard to raise a child that has different needs and extra needs that a typical child may not have. So taking time to take care of themselves in whatever way that may be, something they enjoy, something they like doing, something they maybe haven't done since they became a parent, that they take time to enjoy that again. So we want parents of children with autism to know that it is important to take the time to kind of explore their own feelings, right? So we know they probably spend a lot more time than a parent with a child that doesn't have these differences or needs, that they really kind of forget about themselves. So we want them to know that they matter, that they being okay is going to, and in fact, probably make the journey of that child and their needs a lot easier if they, take the time to explore their own feelings, their thoughts, legitimize that it's a hard process that they're probably having to endure, and that there's people here to help. There's people here to help, and that we care.